everyone, and welcome to this week's stream on interpersonal violence. Today, Lindsay Wilson is going to be talking to us about the health impacts that domestic violence and IPV has on people. So, welcome, Lindsay, again this week for our IPV stream, and welcome to anyone who's watching. So, what are the health impacts of IPV?
Thank you, Rosalia, and hi, everybody. So there are several different health impacts that IPV can have. I think sometimes we just think, when we think of intimate partner violence or domestic violence, what we probably think of is like someone hitting you and you may be having an injury, like a physical injury from physical violence. And that is part of it, right? That's something that can happen. But we also know that the general kind of experience of being in a relationship where there's intimate partner violence can be very stressful, right? You might constantly feel like you're in kind of a fight or flight state. And that we know that sort of prolonged chronic stress can have a lot of different impacts on your health and some pretty bad ones. So the sort of health impacts sort of go beyond just the physical injuries that people can experience from physical violence.
Can you talk a little bit about the I don't know how to phrase this. Usually when someone's gaslit or verbally assaulted all the time, what does that do to a person's psyche health-wise? You know, I would guess that it causes low self-esteem and other mental health issues.
Absolutely. So low self-esteem is a big one. And then the difficulty with that, right, is sometimes then when your self-esteem kind of gets broken down, it can be really hard then to take the steps to leave a relationship, right? If you don't necessarily feel positively about yourself, feel like you have that kind of self-worth that like I deserve better than this, that can sort of contribute to that cycle. But yeah, I think trust can be really impacted profoundly, and that can make it hard to trust other people outside of your relationship, to make other connections in the future, even to have other relationships. And one thing I talk a lot about, talk to a lot of people about, is the impacting the trust in yourself then too, especially if you've been gaslit. That kind of skews your perception of reality, and you don't really know, like, you might not be able to feel like you can trust your own experiences. And sometimes people end up feeling that, I chose this person, so how can I sort of be trusted to make a good choice in the future? But I think general feelings of like sadness and depression, I think especially if you're already dealing with like depression or anxiety or PTSD, a lot of those symptoms can be exacerbated if you're dealing with any, including like verbal, emotional abuse, gaslighting, that kind of stuff. Sometimes I feel like that can be a little more like insidious, right? If someone can kind of get into your head in that way, it can be a little bit harder to move forward, to get help. You can't necessarily see it outwardly that it's happening. A lot of people then end up, you might have difficulty concentrating, and that can impact you in a lot of ways. A lot of people that I've talked to, they talk about feeling on edge. Walking on eggshells is a phrase people use a lot, because you don't necessarily know what you're going to get from your partner. If they're coming home from work, which version of them is walking in the door? What kind of behavior, what kind of mood are they going to be in? You might just have trouble calming down generally, right? If you're kind of in that state of fight or flight, you don't know what's coming next. It might be hard to relax at all, so you're kind of constantly feeling stressed. For some people, they might have trouble sleeping, might have nightmares. Sometimes people cope with some of these issues by using drugs or alcohol, which obviously then kind of have their own set of difficulties that come with those things. Some people, eating disorders can be common when people are experiencing intimate partner violence, because sometimes, food is a way for people to cope. Sometimes controlling Food can be a way for people to feel like they're kind of taking back some control in the situation. So there's a lot of different kind of psychological and like mental health issues that can come up for sure.
So, and while you were speaking, I was thinking that some people, combined with low self-esteem and all those other things, could probably become very afraid to make their own decision. So how can you talk about like what causes that fear of not being because they have a lack of agency?
Yeah.
So can you talk about the fear that brings lack of agency and how that impacts, like a person who has no agency is unable to ask for help, really?
Yeah, exactly. I think it can be a combination of things that can be kind of external. So sometimes there are people who try to sort of please their partner who's abusive, and you can't do anything right, right? Like, oh, I tried to sort of make the right dinner. Well, that was wrong. So then I didn't make dinner. Well, that was wrong too. So it can feel paralyzing, and like you, and sometimes people internalize that, right? Like I can't make the right decision, so I'd better just not. I better just let this person maybe tell me what to do, right? Or sometimes I think it also comes down to that like trust in yourself of, I don't really know what's going on. They're telling me it's my fault, but ultimately like I chose to be here, so maybe it is my fault, and I don't know that I can make a better choice. And it does, like I said, feel kind of paralyzing, right? If you don't think you can make the right choice, then sometimes people end up just not taking action, like you said, and that can make people feel really stuck. And that can be hard sometimes when we want to help folks, but it is part of the reason, like why we are here, why it's part of the healthcare system that we can kind of have these conversations and just sort of spread the information, because certainly it's not going to be something that everybody like hears once and they're like, oh, okay, let's make a huge change right away. That sometimes people need to have some information reflected back at them that like, this is actually not okay what you're going through, and maybe there are some better options for you.
Very recently, University of Maryland did a study. The School of Nursing did a study that talked about the most dangerous time in a pregnant woman's life. In a woman's life is when she's pregnant, especially when it comes to DM and IPV. So, can you talk about the health dangers that pregnant women face when they're pregnant and in a relationship that is characterized as a domestic violence or interpersonal violence relationship?
Yes. So pregnancy definitely can be a time of high risk. It is a time that we know that in many relationships, unfortunately, intimate partner violence can get worse or even begin, and lots of different potential reasons for that. But we know that it can have a lot of health impacts for the person who's pregnant. They might not be able to access prenatal care, or access it later in their pregnancy, which can have all sorts of health impacts. They are typically like less likely to like breastfeed. They might be more likely to continue smoking during pregnancy. They might be more likely to experience bleeding during pregnancy, premature labor, premature birth, miscarriage, or stillbirth. And then for their baby, they could experience an injury, low birth weight, things like that. And maybe they might not be connected to medical care as well. And we know, unfortunately, that homicide is one of the leading causes of death of pregnant women in this country. So it can be a time that's especially vulnerable, as when intimate partner violence is already going on. And we know that sometimes there's also abuse and coercion around like getting pregnant. Sometimes people have a partner that will restrict or tamper with birth control, force them to carry a pregnancy they don't want to, or kind of conversely force them to terminate a pregnancy that they don't want to. So those things can be difficult too, and that might also increase their risk of like sexually transmitted infections and and injury in that way. So definitely when it comes to sort of pregnancy and reproductive health, intimate partner violence intersects with that very strongly in potentially dangerous ways. And for that reason, we actually, I work closely with the maternity team here at the VA. So one of our maternity care coordinators, her name's Janita, she screens every pregnant veteran that we work with for intimate partner violence, just to, help make sure that they're safe. And I know when I worked in women's health, I was screening folks, and thankfully they're awkward questions to ask sometimes, but most of the people were actually happy that we were asking, because it is unfortunately something that can happen.
So what do we do to help women? What are the programs or the treatment approaches, to help spouses who are involved in, who have lost their agency? Because it seems that domestic violence and IPV is a form of power and control. So if someone has lost their control and they're trying to regain their agency, how does VA help veterans get back on track?
Sure. So we have a lot of different options for people. I think last week I talked about RISE, which is a counseling approach that we have that really is focused on empowerment for that reason, because experiencing intimate partner violence is inherently a very disempowering experience. So that modality, first of all, it kind of puts the topics in the client's hands. So, we have these topics we can talk about. They get to decide every session what we're talking about, how many sessions we're having, all of these things. So they have a lot of control in what we're doing, and also what they want to work on between sessions, they have a lot of control over. And I will say the services that we offer generally through the Intimate Partner Violence Assistance Program are really ones that sort of put the veteran in the driver's seat. We kind of exist to be a resource for those veterans. So, if people want to leave a relationship, we can talk about resources to help them to do that, whether it's legal, financial, housing, emergency shelter, safety planning. And same thing if they want to stay. So we're not here to make people make decisions, even if, things are dangerous. We'll definitely, provide education, right? It's important for people to know that, like strangulation, for example, if you have a partner that strangled you, that is really increases your risk, unfortunately, of suffering serious injury or even death. And it's important for us to tell people that, but that's information that then they get to make a decision with. So we really try to put the ball in their court. And sometimes people really do just need information. They're really not sure. That kind of keeps them stuck. Sometimes people just need to have, like I said, have this kind of reflected back at them. I talked to a young male veteran not long ago who was in a relationship where he was being hit by a partner and kind of didn't really have a sense that he didn't have to experience that, right? So we just talked a little bit about very basic boundaries and what that can look like, and how you can say, I don't want to be hit, right? I'm going to leave the room now, but that doesn't mean you're abandoning that person or leaving the relationship. You can set those boundaries, and it's up to the other person to kind of respect them, and then you get to make decisions from there about how you want to move forward if your boundaries aren't respected. So I think sometimes it's really just people sort of get stuck in these patterns, and people come with all sorts of other trauma, right? They come from whatever family they grew up in and whatever relationships they've been in before, and that sets their frame of reference. And so sometimes it's just about saying hey, that's actually not okay for them to do that. And you can leave the room, or you can go for a drive, go for a walk. And then people can kind of have that information to sort of mull over, and then make decisions from there. So yeah, I think a lot of it is just about information, resources. Sometimes people aren't sure what their rights are legally, so we can connect people with legal resources to talk about what that looks like, and then they can, I think the knowledge does really empower people to make decisions for themselves.
What about those veterans who have pets and children and who are reluctant to reluctant to restore their own agency or leave, or because they are fearful that they will lose their children and or pets, because that's a very real fear that might
Absolutely.
paralyze people.
Mm-hmm. Absolutely. And I think sometimes not even losing them, right? It's like you have kids that are in school and you want to leave. Well, are you going to disrupt your kid's life and take them out of school, right? So I think some of that is, I think a lot of it does come down to resources again. So there are resources that can help with pets. If you, places you can stay with your pet, or people that can help take care of your pet while you are kind of in shelter or things like that. And same with kids, there are places that we can make sure you're placed with your kids. There are resources to help help veterans be kind of rapidly rehoused. I've worked with veterans that was a fear. They have school age kids, and taking them out of the school they've been in for years was a real barrier for them leaving. And thankfully, through working with resources that we have connected to the VA and in the community, the veteran was actually able to find housing within the same district and still was able to leave and not disrupt their child's school. So those are definitely big issues that come up, but they're things that we can always try to work through resources. Like, we really want to meet people where they are, because certainly we know that, like, pets are family, and obviously children are family. So those are people that we consider when we're talking about resources. Also, when we're talking about safety planning, those are considering the safety of your children and pets is also something that we always want to talk about. So absolutely, those can be big barriers, but they're ones that we always work through with people in terms of resources.
So can you talk a little now about the physical health impacts?
Mm-hmm.
We talked about the psychological, mental ones. What are the physical health impacts that domestic violence can have on a spouse who
Mm-hmm.
is struggling with this?
So, as I mentioned, there, I think, are the direct physical health implications that I think, are a little bit easier to conjure up in your mind, right? If someone hits you, you have a bruise, or you might have a broken bone, or something like that, right? I think those are the mental pictures that we have when it comes to domestic violence or intimate partner violence. But as I mentioned, that, like, chronic stress that you're under also impacts you internally, right? It has maybe some indirect impact. So a lot of chronic issues, chronic pain, headaches and migraines happen a lot. Stomach issues, like GI issues, like people might find themselves, when you're in a relationship like this, like your stomach hurts like kind of all the time, or you're experiencing some other like gastrointestinal issues that don't really like have a cause, but it can really come down to that constant stress is taking a toll on your body. Fibromyalgia, like other chronic issues that people have can be exacerbated. So like asthma, fibromyalgia, people that have, like, again, like chronic pain and thyroid issues that are ongoing, those can be exacerbated, like psoriasis, all of that sort of thing. People might have sexual or reproductive health problems, like I mentioned, sexually transmitted infections. They could deal with things like, for women, like pelvic inflammatory disease, UTIs, again, issues during pregnancy. And sometimes, when you maybe already have some other issues like high blood pressure or diabetes, those can be exacerbated, right? When you're dealing with this chronic stress, that can impact your insulin levels. It can impact your blood pressure further. And of course, we know if those things get out of control, then you can have further difficulties, right? If your blood pressure is super high, then there's things like stroke, heart disease, heart attacks, those kinds of things. Obviously, that is kind of the extreme end, but we know that a lot of these chronic physical symptoms are related to that chronic stress that can come from an abusive relationship.
How does the VA handle when a partner, we've all seen this scene on television where a partner an abusive partner is bringing his or her spouse to the doctor but refuses to leave, that so that there's no privacy. How does the VA handle certain situations where someone insists on being present during an exam, which prevents the person who is being abused from saying anything about it during a screening? So how does the VA handle that, where like there's that one spouse who's saying, I'm not leaving, I'm going to be in here, and the spouse doesn't feel strong enough to say, I want you to leave?
Mm-hmm. So I think it maybe depends a little bit on the specific situation and the staff person, but I think we would certainly, lots of our staff here kind of have our various ways to talk to folks about asking them to step out, just for, certain like examinations, or just to let the person change or something like that. Because we definitely do not, it's sort of built into our screening about intimate partner violence that these questions are not to be asked in front of another adult or child over two, because unfortunately we know sometimes children share things they hear, and they might share them with the wrong person. So it's definitely something that we're really attentive to when it comes to screening for intimate partner violence. That's also part of the reason why we have those personal safety sign posters in the bathrooms, because that is typically a place where, you can be away from your partner, however briefly. So we want people to know that they can still access resources, even if, maybe they have a partner that's sticking close to their side. But I think that a lot of staff maybe have some different ways to ask a person to step out, like kindly, like, oh, maybe there's a water fountain right outside. Maybe can you grab a cup of water for yourself and your partner and then come back in, or something like that. I think I won't speak for all the providers here, but I know that people kind of have different ways to handle it. Sometimes they might set a blanket policy of like, you need to step out for now. And I think what's important is that we make it clear that it's something that we're looking for everybody. It's not, we're not, and even if this isn't true, that we're not trying to single somebody out specifically, that these are questions we really want to ask all of our veterans privately.
So a lot of times the stereotype is women being abused. So can you talk a little bit, you mentioned, that you had a male patient who was being hit. Mm-hmm. So can you talk a little bit about some of the health and psychological issues that male members of a couple, or and also can you add to that LGBTQ, the health issues that they might face as well?
Absolutely. So yeah, it can look a little bit different for male and female veterans, just some of these impacts psychologically and physically. And we know, I think, because there's a lot of stereotypes, as you mentioned, about who experiences intimate partner violence and like what it means if you're experiencing intimate partner violence as a man. And there's research that shows that there are some different impacts. So like, for example, psychological violence has been linked to mental health issues for both men and women, but increased occupational impairment for men, so it can impact them at work more. And maybe, like I said, that can come down to like what this means about you as a person, maybe some of that self-esteem. Those issues can impact you at work. And experiencing physical violence has been negatively associated with health-related quality of life for men. So it really does impact their overall health and quality of life, experiencing physical violence. And I think, like I said, it can be a combination of physical injury, that stress, that self-esteem, like, sort of questioning one's manliness. In the LGBTQ plus community, things can look a little bit different, only because some of the types of intimate partner violence can look a little bit different. And what I mean by that is, like, for example, like threatening to out someone can be a form of like psychological abuse, right? It can be a form of like power and control, that it doesn't exist necessarily for straight people, right, outside of the community. So some of these things can look really different, especially, if you're a person who's not out, right? And sometimes then people can kind of gaslight in a different way, like, well, I'm a woman and you're a woman. This isn't domestic violence. It can't exist in our community, right? Or this is normal in this kind of relationship. Sometimes there's specific physical abuse, especially if you have, for example, like a trans partner who's transitioning, where you might restrict their use of medications, might impact their recoveries from surgeries, deny them access to hormones. Sometimes if you are engaging in public displays of affection in a place that you know is hostile, like that's potentially dangerous. So a lot of different kind of like versions of abuse kind of within the LGBTQ community that can that can have deleterious impacts too, because it also relates to like your identity. And I think that that's the case too for like men who experience IPV, that like there's something related to like who you are as a person and kind of what that means, and that can really have a lot of additional psychological impacts when it comes to like self-esteem and trust and isolation, things like that.
Is there anything I haven't asked you that you want our veterans and their family members to know about the health impacts of domestic violence and IPV on a person? Like, or is there a higher risk of suicide? Is there, or murder?
Yeah, so
suicide, it could be murder. So what are the impacts of some of the untreated health issues that go along with it?
Sure. I think with some of these psychological and emotional impacts we talked about, certainly self-harm and suicide are a risk for our veterans. Unfortunately, if you're experiencing IPV, you also can be at much greater risk of being killed. And it's the same thing if you have an abusive partner who is suicidal. Unfortunately, like murder-suicide is a risk. And almost, I believe it's 72% of murder-suicides are perpetrated by an intimate partner. So it's that is also certainly a risk. I will say strangulation is a particular type of physical violence that can be very dangerous, because we are getting into cutting off oxygen to the brain that can unfortunately have impacts very quickly. It can have impacts even if unintended, and it can have impacts kind of even down the road, right? So even if you feel okay today, it could have some impacts on you later. So that is something that's really important for folks to know. If you have a partner that's strangling you, putting their hands on your neck, choking you, that can be very dangerous. And that's something that we really do want to make sure you know, that you can kind of talk to us about that. Like I said, we're not here to make people do anything they don't want to, but we really want you to be able to make informed decisions, and knowing that strangulation is a really high risk behavior is important for you to know. So just so that you can do what's best for you and your health. We know that IPV can impact health, which is why we are part of the healthcare system. It's why we try to have everybody screened when they're coming in for their primary care appointments. So it's why they're asking. If you get asked these questions in your primary care appointment, it's not just you. The nurse didn't look at you and think there was something going on. This is something we're really trying to ask everybody, because we also know that this is happening to people we don't think it's happening to, right? I get a lot of male veterans I'm working with, maybe a lot of older veterans who aren't necessarily the people that we picture. A lot of veterans in like same-sex relationships in the LGBTQ plus community. So it's important for us to screen everybody. And it is really something that we want you to know that you can talk to us here at the VA about. So if you're having these symptoms, bring them up to your doctor. If you need some support around them, they know how to refer you to us. And you can also reach out to us directly. But this is really, we consider this like a healthcare issue. I think sometimes that's not the connection that everybody makes. But ultimately, it does, it does impact your health. And we as healthcare providers do want to, the VA, we have our kind of whole health orientation, right? We're thinking about your health outside of just like, you're sick and the doctor gives you medicine. It's really about your whole life, your functioning, who you're around, your goals, your overall well-being. And this is part of that. Your relationship health and safety is part of your overall well-being. And we are here to support you with that.
So aside from through a primary care appointment and the screening, because some people do hide, like they feel like they can handle it until they can't. So let's say they, didn't tell the truth during their screening because they wanted to hide it. And now they've finally reached the end of their rope. How do they get in touch with, how can they come into the VA to get access to IPV care, or, if they fudged their screening?
Sure. You can really talk to any of your providers. You can always contact us directly. We've put our information in the comments before, and we can do that again. You can always contact us directly, but you can also talk to, whatever providers. If you have a mental health provider, if you're just talking to your doctor after you've been screened, and you can say like, well, this is, I said no, but actually I do have some concerns. It's always okay to bring it up. The door is always open. It's not that you're screened and you didn't say anything during that and now you can't talk to us. Really, the screening, what I always say is that's a tool. Obviously, it would be great if people feel comfortable telling us how they actually feel. We know that that's not always the case. So I consider that a tool to show people that this is a conversation we're having at the VA, right? That this is a place that you can come to, and this is a concern that we have. And we want to hear about it. So we have resources and support here for you. So even if, you didn't feel comfortable talking to the nurse about it when they were doing your screen, if you feel more comfortable with your provider, if there's another provider that you're seeing, all of them can refer you to us, and you can also just contact us directly too.
So we put the information in the comment section. That's where the phone numbers are. I want to thank everyone for joining in today, and also thank our veterans for their service. And please let everyone know that this is a safe, free, judgment-free zone. So if you're a veteran out there struggling with this, come on in and see Lindsay or Caitlin. Thank you very much. Bye-bye, everyone.
Bye. Thank you.